Hello, and welcome to The Breakdown, the orthopedic podcast where we dig deep into the world of bones, joints, and everything orthopedics. I'm your host, Lauren, and today we're talking about the balancing act of female physicians, the beautiful chaos of being a medical provider and a mother. How in the world do they do it? Today, I'm joined by two amazing mothers who also just happen to be orthopedic surgeons, Dr. Meghan Bishop and Dr. Danielle Ponzio. Hello, ladies. Welcome to the show. So take me back to when you guys were little girls and you were daydreaming about your future. What did you dream about? how did you see yourself as an adult?
You know, I don't remember what I really dreamed about when I was really little. Like, I think when I was little, I wanted to be a good athlete. Like, I loved sports.
Yes.
And
Okay.
athletics, and I loved running, and that was my focus, frankly, through out much of high school. I never really saw myself doing anything else really at that point until I became a little bit more interested in medicine when I was a teenager, and, I had influence from my mom, who was a nurse. And so it was somewhat exposed to that. But I can recall finally loving sports and thinking, I want to be a team doctor for the Philadelphia Eagles. That's what I remember thinking. That was my dream when I was a teenager.
So you were an Eagles fan as a kid.
I loved the Eagles.
Good girl.
I love sports, and I love to I think I want to meld what I like into my career one day. So now I take care of the Phillies, so it's close.
Amazing.
But yeah, so that's kind of what I thought about when I was younger.
Wow, that's actually really sweet. Your dreams came true. You're taking care of the professional athletes. Yeah, you were able to tie in both medicine and sports. Love it. How about for you, Dr. Ponzio? What did you dream about? What did you want to become?
Also a lifelong Eagles fan.
Yes, my girls.
Yeah, I think as far as my dreams, similar to Meghan, I was an athlete growing up. And so probably at the earlier stages, I thought I'd be a professional athlete, maybe an Olympian.
I love this.
Something like that would be really fun. But I did know about my dream of orthopedics, I think, earlier. And that was because my dad's an orthopedic surgeon.
Yeah.
So I grew up sort of thinking that was a very accessible thing. It was part of my day-to-day life. And so there was sort of never a doubt that was what I wanted to be after I was done all my athletic
Right.
and so that was kind of neat. And I did get early exposure because of it. I think the main takeaway, even at a young age, was I could see that my dad was changing people's lives. I always wanted to go with him to meet his patients and
how sweet. Yeah.
And even as I get older, I kind of thought about other careers, and I just didn't feel like there were many that let you really interact with
that
people
reward too. Yeah.
As a physician. So
right. So did either of you dream about being a mom? Was there a conscious decision should I have children? Should I not have children? Or
I don't remember dreaming of being a mom. Although when I ask my 5-year-old girls now what they want to be, they want to be a mom.
They do.
So, yes, I think back and I'm like, did I feel that way at their age?
Yeah.
Maybe I did.
Right.
But definitely, later in life, I knew I wanted to be a mom.
Right.
And it was a matter of when and how to fit it in and thinking about the big picture.
Right.
Yeah, I would say, I don't think I would ever describe that was what I dreamed to do, because I think it was part of my dream, but it wasn't necessarily, the only thing.
The
only thing that was going to, fulfill me in life.
Yeah.
So it certainly was always part of my plan, and it just was, when is it going to work? And Danielle and I both had children probably a little bit later than a lot of people were in our mid-30s, which, simply have 2 very healthy children. Danielle has 3, but I'm very fortunate for that. But it definitely took a little bit more planning and a little bit more foresight of when is this going to work?
Yes, right.
When's it going to work best for my career? When's it going to work best, with our lifestyles and things like that? And, I don't think there was a right way to do it for anyone, but, it seemed to have worked for us.
Yeah. So let's talk about that. Let's talk about your medical journey and through medical school and residency and fellowship. So like you said, you had to plan for that. So when did you start? Was it after fellowship that you got married and had, because I know sometimes maybe during fellowship, when did the family start for you? Once you started your practice after all the training and everything?
I met my husband, Matt, when we both ran track and cross country at the College of William and Mary. So we met when we were like 18. So we were really young.
Ah.
We didn't actually get married till 10 years later, in our late 20s, when I was the second year resident, I believe. And actually, one of my other co-residents, who was actually with Nina Katowski, Danielle's year, convinced me to try to get married on night float during second year of residency, which is when you have to work overnights for like 2 months straight. And
oh my gosh.
you get the weekends off. It's going to be great. It was like the worst I've ever looked. So it was probably not the best plan to get married on night float. But yeah, so we got married when I was 28 and like in second year residency, and I didn't have children until like, frankly, almost 10 years after that. So
Wow.
we always knew we wanted to start a family, but it's really hard to do that during residency, and you learn, you don't want to take time away from learning, your craft, and fellowship in 1 year. So like, if that's probably not the best time to have taking time to, and, frankly, I wanted to spend some time with my kids. It's hard to do that during training. You don't get a lot of, most people during residency or fellowship would probably only take about 6 weeks, so we got a little bit more time than that when we were actually,
in your practices.
First job.
Right.
So that was all kind of part of my planning. And then you got to think about boards as well. So in your first 2 years of practice, you take the part 2 of your boards. So you have to collect cases and things like that. So those are things you have to think about really, because you want to try to get that done in your first 2 years. And if you take a gap, for maternity or for having a baby, or God forbid you have any kind of, complications during pregnancy, that might delay that.
Prolong it. Yeah. Right.
Yeah.
Right.
So all those things were, things that
you
we
have to
waited.
think about. Yeah. Yeah.
Yeah,
How
I
about
agree.
Megan?
I agree with Megan, everything she said. I got married once I was into practice. And so after all the training years were finished, and then had kids shortly thereafter, and again later in life. And there's good data that says that in general, orthopedic surgeons amongst women generally have families a little bit later.
Yeah. So let's talk about females in medicine, specifically in orthopedics, because I read this and I always knew, just having worked at Rothman, we don't have many female physicians. We're actually getting more and more, which is amazing. When I started, there was one female doctor, Bunky, Dr. Barbara Freeman, and she was a rock star, she held her own. But so I just read this the other day, that orthopedic surgery is currently the least female dominant medical specialty in the United States. I didn't realize that it's the least, that there's no other specialty with less females than orthopedic surgery. Why is that? Why do you guys think that's the case?
I think there's a lot of reasons, but again, there's data too to support this. But I think there's not very many female mentors in orthopedics.
Right.
So going through medical school and training years, you might not meet people that are doing that to show you that, hey, there's a path here that you could do that. And then also there's a sort of a perception that you need a lot of physical strength. And it's not completely wrong. I do think, it's probably a reason why Megan and I are athletes and we gravitated towards.
Interesting. Yeah, because I did read that the physical demands of the specialty is a reason why it's so explain that. What are the physical demands? Yeah, how does that work?
You want to speak to it?
Well, I mean, for Danielle is the joint replacement surgeon, so that's definite physical demands. On large hip replacements, I mean, that's certainly a struggle. But taking care of knees, shoulders, things like that, it's a lot of positioning of the leg, and patients are of all different sizes. You can have patients you're taking care of, especially if you're taking care of a professional athlete. Those people are generally,
bodies,
they have much larger makeups, but particularly for knee scopes, you have to actually balance the leg on your body to be able to scope the knee position in certain ways. So you certainly have to find techniques that work for you. Certainly, it's a little bit more skill and management of your teams if you don't have strength that a lot of guys have versus But there's always ways to be able to do every procedure. If you're a female, brute strength isn't the only way to be able to do something. So you employ your teams, you employ different strategies and techniques. And I actually had a patient recently tell me this week that he had no pain after surgery, and it was his third knee scope, and he said, "I must have delicate hands." So I said, "There you go." So
look at that! I love that.
I guess.
Yeah, for sure.
Joint replacement is also very physical. So oftentimes after a day, a full day of the OR, you feel like you've been working out all day.
You can feel it. You feel sore. Your body's sore. Yeah.
So
sometimes you're wearing lead and like you're doing trauma cases and things like that. You're the OR lights. It can be like it certainly can be like a workout, during the day.
I sometimes joke because I tend to get really large patients sometimes, and I'm like, they must go down that list at Rothman and find the littlest girl that's doing my replacement. Like, I want to go to her.
That's great. Oh my gosh. Well, we have to talk about what you two are doing to improve the stats of females in the specialty. So tell us about the Women in Orthopedic Summit. So this will be the third annual coming up this fall, correct? The third annual. And tell us about it. How did it get started? So the two of you got together and said, we need to get more females in here, or just to set the example, to be those mentors that you two were looking to have when you were coming up in the field.
We call the summit Inspire, and it's going to be in its third year. So we're like very excited about that. It's grown each year. And Meghan and I have known each other through residency. And then, of course, as you pointed out, we're one of the few of the women here at Rothman. And so I think we kind of carry that responsibility of trying to let others follow in our footsteps and to kind of give them the tools that they might need to get there. And so we started to brainstorm what we wanted to include in a conference like this. And it's really open to everybody who's interested in orthopedics, medical students, residents, fellows, and then also practicing surgeons out there. And then we also tied in like industry and hospital administration. So it's like any woman or man that really supports the idea of women in orthopedics. And then Alex Vaccaro, our president, our CEO.
We know that guy, yeah.
Alex Vaccaro of Rothman, he really made it possible because he came to us and said, hey, like if we had to do something to support women in orthopedics, what would it be? You guys go dream it up and I'll help you make it happen.
Love it.
And that opportunity was special.
Yeah.
And so if it weren't for him doing that, I don't think we would have Inspire. But the following has been really great. The impact for people has been a positive one with lots of great feedback coming back to us. And so hopefully we can keep going for years to come.
Amazing. I attended last year and I absolutely loved it. And I feel like you don't have to be a woman in medicine to get anything out of it. I mean, I took away so much. It was just so inspiring to hear, some of the struggles, but how people overcame certain things and just the support, the feeling of support in the room. And women flew from all over the country to attend that, which was incredible. It really was. Kudos to you guys. Congratulations, because you're doing wonderful work with it. So I'm excited for that. This will continue to be an annual event. And real quick, when you invite people, can anybody attend? Anybody can attend, yeah. So
anybody can attend.
You don't have to be in medicine or in the field,
you don't
right?
have to be female. We would be happy to have males that would and be like allies and support, the mission of increasing females in orthopedics. And it's not necessarily just that. I mean, the conferences teaches leadership skills. It's a networking event. There's a lot of different aspects that we kind of looked at towards it, and we said, what do we think, our younger women that are interested in orthopedics need? And I think this is supposed to be kind of a confidence day of confidence that you can succeed in this field. And this is how you can be successful in medicine and in a minority group. So, that's kind of the idea of the day. Our next one is going to be on October 10th.
We have it planned already. Wonderful.
We do.
October 10th.
Again. Yeah, but the Four Seasons in Philly again. So, we're still coming up with our final agenda, but that will be the date.
I'll be sure to post that with this. Yeah, the details and everything. It's such it's a beautiful day. You're in a beautiful surrounding. And last year it was a beautiful weather-wise day where we got to, go out onto the balcony afterwards and enjoy each other's company.
Registration is officially open. This past week we just opened it.
Oh, so wonderful. This is great.
Starting early this year.
Wonderful. Yeah. I'll be sure to post all the details. All right, so let's get back to motherhood. So real quick, let's review for the listeners. So Dr. Ponzio, you have 3 children, and Dr. Bishop, you have 2 children. So tell us about their ages. What are they into? And you guys sent me the most beautiful pictures. We're going to show some of those pictures. They're the most adorable children. So tell us their ages and what they're into.
So I have Audrey and Natalie. They're 5-year-old twins.
Twins. So cute.
Great.
God bless you.
Thank you. And they're best friends, of course, most of the time. And they're in dance class. They actually started playing a little bit of ice hockey, which I have played growing up. And so that's
you played growing up? You played ice hockey? That's amazing.
Yeah. So they're trying that out. But really, I mean, they're young. They love going to preschool, and if I ask them what they love the most, it's spending time with their mom. So, yeah. And then my little guy, he's 3 years old, and his name's Everett. He just started preschool, and he's pretty simple. He's just a lover. He loves to again be with our family, with our dog, and they're at the playground right now. So
so great, so great. How about you, Dr. Bishop? How old are your two?
So I have Logan, who he is 4. So he is super into sports right now. So we've started T-ball this year. He does gymnastics with his sister, and he's into playing hockey, but just, we don't actually have him signed up formally for hockey yet, Danielle. Right. But so yeah, he loves the Phillies. He loves the Eagles. He was super excited when they won the Super Bowl. So, those are his biggest interest right now. My daughter is 2. Her name's Rory. She just turned 2. So she was an early walker. She walked at like 9 months. She's been running every. She's like super talkative, way more so than my son. Maybe it's a second child thing, but
the second child. Yeah, there's something.
It's gotta be. But she's got a very fierce personality, I would say. She's already like entering the terrible 2 stage. But she's super into the color purple. She really likes bunnies.
She sounds like my daughter. Yeah. But with mine, it was terrible 2, then terrible 3, terrible 4. We're at the terrible 9s right now. I never got out of the terribles.
Don't say that.
Yeah, I don't want to hear that.
Oh my gosh, no, she's sweet. They're just, she's strong personality, and they say that's what you want. You want a girl that's going to be strong and can stand her own, and that's for sure.
Yeah, that's for sure. She does have a strong personality.
So sweet. One of the pictures you said, so was she Bluey for Halloween?
Yeah,
so you guys are Bluey fans? I mean, who's not, right?
I love Bluey. My kids love Bluey. I think it's a really great show, frankly. I
learned from the parents. I love Bandit. He's my favorite.
My kids learn a lot from it, too. They'll pull out random things. I'm like, where'd you learn that? Oh, from Bluey.
Bluey. They're the best. They're the best. All right. So talk about being pregnant during, one of the questions I asked you guys was it like being pregnant in the operating room? And you sent me pictures of you. And first of all, I couldn't even tell that you were pregnant. You're both so tiny with these little bellies. So cute. But what was that like? Is the operating room conducive to pregnancy? Did they have to make any changes? Tell us about that.
I think it was okay. I didn't really need to make any major changes, although I would say my OR teams for joint replacement are pretty consistent. So I work with pretty much the same people every time.
Nice.
I'm so grateful for them, because when they found out I was pregnant, they did everything that they could to allow me to avoid lifting legs when I could. They would remind me to sit down. They're telling me to go get drinks. They would go put food out in the lounge, so that
wonderful.
In between surgeries, I was making sure that I was taking care of myself, because they knew that on a normal day when I wasn't pregnant, I wasn't really putting that first,
Yeah.
So
right.
That made life easier.
That's great.
Yeah, I don't know. Frankly, I was lucky through both pregnancies. I was able to operate up pretty much to like 37 weeks for both of them without an issue. My second pregnancy was a lot harder because my son was in daycare at the time, and I think I got every viral illness that was to man.
Yes.
So it wasn't even just like normal pregnancy
Not
sickness. I was like sick all the time. So that was a little bit harder, but was able to work through it, and we have to. So we did.
Yeah. And how about the maternity leave? Did you take the full time? Did you feel pressure at all to come back early? What was that like?
For me, so with my twins, I was planning on taking 3 months, and mostly because I had 2 babies and I was new to motherhood. So sort of figuring it out.
Yeah.
And I was grateful for that time. But they were born in 2020 during COVID. Oh, actually, COVID just started. And so it happened to be that, things sort of shut down when I was supposed to come back. So while I was upset about like the career side of my life and things being on hold, the silver lining was I did have more
to spend more time with them. Yeah, for sure.
A lot of telehealth at the time, so it was like take care of the baby, do a telehealth visit. The babies.
Wow.
So it worked out that way. And then my son, it was a little bit different. I was a partner at Rothman at that time, so I did feel a little bit more pressure to get back to a busy career and make sure that everyone was taken care of, in my practice. So I think it took about 5 weeks for him.
Oh, wow. That's not a lot. Yeah. How about for you?
Yeah, I took 12 weeks with my son, which I think was enough. Like, obviously you always want more, but like I felt ready to go back at that time. And, it was enough. We certainly had like enough time to bond and things like that. And, figure out kind of what his care was going to be after I left, all those things that you kind of worry about. And then my daughter, I was actually transitioning back to Rothman in South Jersey, and I got like more like 16 weeks because of that. So like I was in between moving. So, both of those, it was really great to have that time. I think it was one of the benefit of, for me, not having, a baby during residency or during another part of my career, that I wasn't able to actually like take that time without stressing too much.
Yeah,
so,
right. Good.
It worked out pretty well.
Great. Let's talk about the husbands and your support system. So how do they support you through the chaos daily? Are they pitching in just as much with all the to-dos and, the drop-offs and the pickups and lunches and dinners and stuff? How does it work over there?
My husband's a detective, so his schedule is a little more flexible than mine. He gets holidays off very readily and things like that, and he's able to take off if he needs to. And so he is really helpful with my kids. Yeah, but he's not the one coordinating everything.
Yes.
So I'm keeping track
the
of
mental load of it all and organizing. Yeah,
that's 100% on me. Yep. He doesn't really know what's coming, what we're doing next. So, and even things he's done before, sometimes he's like, well, what time's Dan's class again? And we're like, but he will chip in any way necessary, especially when it comes to our kids. And he also helps with dinner a lot. So we tend to sort of take turns cooking dinner.
I love that.
Yeah, so I think that's really nice. It helps with the flow of the week. And it's usually like my OR days where I know I'm not really going to be home in time to prep dinner. So we'll try to initiative on those days. And then the other days I'm sort of planning to take over for those days.
That's great. How about for you, Meg?
My husband, Matt, he is a chief accounting officer of a company called Imperial Data. It's a packaging and distribution company. So he works a lot, frankly. His hours are probably sometimes worse than mine. So he generally doesn't get home at night until I've already fed the kids dinner and things like that. So, and getting them ready for bed and most nights. So we have a big support system that we rely on. So we have an au pair actually that lives with us. She's been great. And then we have my son's in full-time daycare. We're probably going to start my daughter in some part-time soon on top of having an au pair. And then my in-laws actually made the move from Pittsburgh to move 5 minutes away from us last August. Has been really, really helpful.
That's great.
Have family close by because we rely on them a lot. They actually have my 2 kids right now.
Wonderful.
So we have a big support network that we rely on.
You need it. Yeah.
Yeah, we need it for sure. So, I do think a lot falls on the moms in general, as Danielle's explaining, just because that's just how the nature of the beast.
Yeah.
And, even when you're not doing things, you're kind of the one that's instructing and planning a lot of the time. It's just like that with dance class, but that's just kind of, I think, how we're wired to work.
Exactly. And knowing what they like for instance, my son, he only eats Nutella sandwiches for lunch. From when he was in pre-K, he's in 4th grade now, only Nutella sandwiches. And Target is the only one that has the Nutella, the Uncrustable ones. And it's just like, oh my gosh, if we're low on the Nutella sandwiches, like, it's, what am I going to do? So like little things like that, just making sure. Alex I don't think he knows Christianese Nutella. So the moms, they do. We take on so much. What about your friends? Are you seeing your friends? Do you have I hardly get to see my friends. Everybody's so busy with the kids and running around and everything. But we have a group chat, and that's how we kind of vent and get our complaining out or whatever, just to be there to support each other. And recently we started with the voice texting, which is nice because it's like, oh, you're human. You are human. I can hear your voice, which is so nice. So we voice text to each other. Do you guys have that time for yourselves? What do you do to just give that energy back to yourself?
I think my closest friends that I see most regularly are actually my cousins, and my siblings. I have 2 brothers, and then I have a lot of cousins that are very close in age and all live nearby, and they have kids that are kind of we have kids that are all the same age. So it's a pretty easy hangout when you can just kind of let the kids all play together and things like that. That's, my closest support network. But I also I like to run still. So that's outlet for me. I don't do it very often, as much as usual, but I try to, if I can get out even for 20 minutes, every day, that's something that's
great. It's so important. Yeah.
But I do have a local other physician that lives in, same town as me that will try to, she's young kids, so we'll squeeze out and try to do a quick run together. So it's actually nice doing it with someone else, kind of hold you accountable to make sure you go and try
that makes all the difference.
For yourself. Yeah.
That's awesome. All right. So back to the work side of things, you're handling motherhood and everything. Do you experience, and I'm sure you do, I think every mother does, that mom guilt? Or, they say when you're doing well at work, the home life is falling apart and vice versa. How do you it's inevitable. We all go through it. How do you handle it? I guess, like you said, Dr. Bishop, making sure you get that time, that mental time to go out and do things for yourself, take a quick run. But any other tips or suggestions for mothers out there that may be dealing with that too?
We talk a lot about work-life balance, and terminology has kind of evolved to be more work-life integration. So I think I try to think of that, and it's not always going to be perfect. And some days you're going to have more demands on the work side, and some days it's going to be the family where you have to put all of your focus. And you do feel some guilt sometimes that you're not giving all of your attention to one or the other.
Of course, yeah.
But you work through that. And I think the outlets, like Meghan mentioned, running, I like to run too. I use yoga, Pilates to kind of clear my head. And I found sort of techniques there that have helped me sort of compartmentalize a little bit and to be able to shut down one side of my life and kind of focus on the other without feeling so much of that pressure in the background.
Yeah. How about your weekends? Are your weekends pretty much free? Are you consumed at all? Are you rounding at the hospital on weekends, or are you able to dedicate the weekend time to the family and get together and do family fun activities?
Yeah, I always try to do that. I would say Danielle and I both take call still. So, once every 6 weeks or so, you have a weekend that you're on call. So thankfully we don't have to be directly in the hospital the whole time because we have residents help that are there. But, the operative cases or emergencies that come in, you have to go in. So that's part of our responsibility still. And sometimes we have call during the week, which would account for that too. And I also cover I'm the head team physician of Drexel as well.
I'm a Drexel alum. Yeah.
You are? That's awesome.
Yeah.
Go Drexel. And then, I also cover some high school football games. So there's obligations like that sometimes fall on the weekends too, if there's sports and things like that. But eventually I want to be able to integrate bringing my kids and family to those things. Because I think it's fun for them. So when they're a little bit older, I hope to do that. But to go back to your last question, I think my mom guilt has kind of manifested in that I think I do a pretty good job on a day-to-day basis.
Good.
Being there for my kids, but I don't do as much probably with some things with my career at this point in the stage that I would like to. I don't go to tons of industry conferences and things like that. I go to a couple conferences a year. I probably would do more. I would probably travel more. I would maybe go a weekend away with friends or something like that. But I don't really travel away from my kids much because I'd rather spend that time with them right now. I'm not working out as much as I used to just because, I just run for 20 minutes and that's kind of enough because I don't want to be spending 3 hours working out like I used to and not spending that time with my kids. So I think that's kind of how I've balanced
give and
things.
Take.
I try to be there mostly on a day-to-day basis. I take small things that I know mean mean like a lot to me at this stage, just really to keep your sanity. And then like, I know this time will pass, like Danielle said, like, eventually we'll kind of ramp back up and I'll be able to go to, more dinners and things like that for work. But it's kind of all of a balance, which will one day kind of sway, back and forth.
But truthfully, when our kids are young, I mean, it is so much fun. So it's like, I don't want to miss out on anything.
Of course, yeah.
Being a doctor, I do think you have some say in your schedule and like you can make it work,
Adjust things, yeah.
Then I make sure that I'm going to be there. And I just adjust my schedule. And that's a nice thing at being at Rothman, that they allow you to have that bit of flexibility. Right. Because we naturally work very hard. So we're not, we're going to make up for any time that we're away and make sure we're taking advantage of the time that we're off. So,
yeah, because I think that we don't take, we get a lot more vacation than I think we take, all of us. So and it is a nice part about Rothman having being in private practice, a private practice physician, you have a little bit more control of your own schedule and things like that than if you were hospital employed or something like that. So, if I have to close my hours an hour early to go to my son's daycare graduation or something like that, it's not, you're not going through hoops, to be able to.
That's so important. That's great.
So, that's certainly a benefit of, working at Rothman.
All right, give it to me straight. What's harder, knee surgery or putting the kids to bed at night?
Well, I mean, it depends on what knee surgery you're talking about here. Frankly, my kids are not good at going to bed. Yeah. It's a struggle. It's half my night is consumed with that. So it definitely takes me longer to put my kids to bed than it would do to do a meniscus. So, I would probably, certainly there's more higher stress level and importance level with surgery, but it takes longer to get my kids to bed.
Yes. Yeah. Oh, I believe it.
Same answer.
Are they all out of the cribs? Are any of them in cribs? They're in the big beds now, right?
My daughter's in the crib still.
Yes. And that was the hardest thing for me. I thought that, okay, when they're in the crib, I thought once they sleep through the night, when they were in the crib, that was going to be the hardest thing. And once we got through that, I'm like, all right, that wasn't that bad. Then we transitioned from the crib to the big bed. That was a nightmare. That was 1,000 times worse because now they're getting up, they're coming out of the bed, and all the books say, oh, just don't say anything, walk them back to the bed, lay them there, and then they just follow you like a little duck right back to your bed, and it's back and forth all night long. Oh my gosh,
Especially mom. I think they always want their moms, and it's not the way to sort of manipulate the system.
Yeah.
So that's the tricky part for me. And maybe it's mom guilt. I don't want to be the one to be firm and say, get back to bed.
Yes.
All right, I'll read you one more book.
Yeah. And especially if you have only had an hour with them during the day before you put them to bed after work. If they're coming in your bed at 3 a.m., you're mostly
going to snuggle up with them. Yeah. How could you turn their cute little faces away? Oh my God. What advice would you give to your younger self or to a med student who's dreaming of having a family one day? What would you say to them?
I always think back to when I was in those younger years, even in college. And I think I worried too much about when was I going to put all these pieces together?
Yeah.
And when was it family? And sometimes I thought of I had to plan everything out and you're in medical school, you're really used to that regimented approach. Yep. Everything's scheduled. You're going to be in 4 years of that and 5 years of residency. And I think you have to let go of that part of you a little bit. When you try to plan ahead too much, you kind of risk turning things down. You might not try to apply to certain schools that you think might be too far away and you won't have support for your family. There's things that may influence your decision making and you're not really at that point. So take one step at a time.
One step at a time,
And don't look at the big picture too much.
Right.
Yeah, I think that's really good advice. I mean, I think also, people are always saying women can do it all. You have to be able to do it all, which, you can do it all, but maybe not all at the same time.
Yeah.
So I think you're not going to do everything great if you're trying to do everything at the same time, and you're going to burn yourself out, and you're not going to be, satisfied. And so I think there's, as we talked about before a little bit, there's a balance. Some days you're going to have to put a little bit more towards your career rather than your family. Other times you have to commit a little bit more time towards your family, and there's going to be times where you can put a little bit more towards yourself. But it's really hard to do all of that perfectly at once. And I think, if you let go of that and kind of accept that and
yourself,
it's very helpful.
That's great advice. Yeah. How do you think the medical world is? Oh, I'm sorry, Danielle. Go ahead.
Okay, I was just going to say, when you're in your younger training years, you are sort of trained to say yes to everything.
Yes, right.
Always going to do the extra case. You're always going to sort of say yes because that's the nature of being in that part of your life. And it's a bit of a hard transition as you enter your actual career and your practice. But you do have sort of the luxury of then being able to figure out what are the things that are important to you? What do you want to build your career on? And then saying yes to the things that really matter. And then you have to learn how to say no to the things that don't. Yeah, and it's a weird feeling at first, but I do think that makes a big difference.
Absolutely. Yeah, that's a great tip. How do you think the medical world is changing for women, especially mothers? Have you seen any changes over your time from your training until now? Have you seen anything, I don't know, that came about that's in support of females in medicine?
Well, the number of women in orthopedics is continuing to rise.
Yep.
Each year, we're getting more women that are interested in orthopedics, more women matching. So long term, I think we're looking for more women in leadership positions like that to filter into that realm as well. Yeah. In terms of, supporting mothers and supporting, young women that are interested in orthopedics, I think that it's very variable where you are still. There's the ACDME, which is what the governing body over trainees has made some rules that I think are a little bit more beneficial. I think you probably get 6 weeks, protected time after you have a baby now, which certainly is not a lot, but before I think it was not as protected as it was. There's a lot of resources out there for young mothers that are interested in breastfeeding and interested in like support groups and things like that can kind of help you figure out how to do that stuff as a trainee. They have ways to, people can support each other and figuring out ways how to get help, people help. The best ways to have people watch your children, especially if you're having children in residency and you don't have any family nearby. So I think there's some good support groups out there that I've seen that can be good resources for people. But I still think there's a really long way to go. I mean, there's obviously we don't have one large national maternity policy for people, but I think medicine is pretty far behind some of the other professions out there in the way we support our women and our men and from that respect, because there's probably no paternity leave really anywhere in medicine, or very little. Right. So I think we probably can do better in that, but it's hard because a lot of it is financial, and physicians really can't take that much time away from practice because it's a craft. You need to be able to, stay up to date as a surgeon and things like that. Right. So it's a fine balance. I think we are improving. I think there's definitely ways we can continue to improve, but as we put more women in the field and more people that, care about these aspects, I think it'll continue to head in the right direction.
Have a good positive change. Yeah. Right. How were you guys with maternity leave, your first day back? Was that a hard day for you, leaving the babies?
It was really hard to leave the babies.
Yeah. Yeah.
I feel like it was really hard, but when I got back into work, I felt good. I was like, this is I felt normal once I got to work, it was fine. Yeah. Leaving was hard, but once you got back in your element and you're like, oh, and I remember I really loved doing this.
Yeah. It's you just had to get back to the rhythm. Yes. And it almost feels good when you do strike a good, reasonable balance between things. You're like, okay, I'm doing pretty well.
I can do this. Yeah. Right. I was lucky with our first baby. My mom watched him. So, I remember I dropped him off to her and I literally skipped. I was just like, freedom. I skipped to Starbucks. I got my coffee and I was like, yes, I'm like freedom. Because he was born in January and it was an awful winter. We were stuck in the house together and it was just me and him. And of course, I adore him. I love him. But it was just like, oh, freedom again, And then everybody gave me the warning, oh, it's going to be a hard day. And all day long, they're like, are you okay? Are you okay? I was like,
I'm great. The coffee. Dropping the baby off with your mom is certainly something you're not going to worry about. My son, I had a new nanny that I met twice.
And that, right.
It's a little stressful.
The different situation for sure. Wonderful. Yeah. Oh
I know.
My gosh.
We have a nanny too. And I'm checking the video to make sure everything's okay.
and you have that cute picture of you and your twins in their little doctor outfits in front of the hospital. Have any of your children come with you to work?
Yeah. My kids have. I've brought them with me to round on the weekend.
I love it.
Yeah, and specifically my girls. I mean, they both wanted to get all of their dress up gear on, so they wore like their doctor outfits.
Cute. Yeah.
Before we left the house, they both went and grabbed stickers, stuck them in their pocket.
And they gave the patient stickers?
Stickers for the patient.
How sweet.
So I was
that.
like, I'm glad I brought them because they had such empathy for patients. It was like so refreshing to watch.
Yeah.
And how concerned they were at somebody who had like, an ACE strap
had to
on.
have surgery. Yeah.
Yeah. So they really, their faces, their expressions, it was all like priceless, and they remember it, so they always ask now if they can come, and they ask how my patients are. So I think they have like an idea of what I'm doing, and I think they'll remember that.
Yeah. Oh, that's so great. How about you, Dr. Bishop? Have they come yet?
So my son's come to a couple Phillies games that I've covered.
Fun. That's great.
He likes that perk. He likes like, oh, Mom, can I come to the Phillies game with you? And I'm like, oh, not tonight because I don't have your dad to help, But he's come to a few Phillies games and he really enjoys that. Ultimately, I hope my children one day are just like proud that, they had a mom that worked hard, and, we have a pretty cool profession that we're able to get people kind of back to their best selves and hopefully, make a tangible difference in people's lives. So I hope one day that they, realize that we're one of a few, Danielle and I, with women in orthopedics, and we get to do a really special job. And, I would just hope that they were proud one day.
Absolutely. And, it's leading by example and showing them by example of what you do. You can preach to your kids everything and tell them this is a right way of doing it and this is it, but seeing you guys in action and show how much you care for your patients and what you're doing to improve lives, and oh my gosh, that will stay with them forever. Well, thank you both so much for taking time out of your crazy busy schedules. I so enjoyed this. I enjoyed just the conversation and getting a little peek, a little glimpse into your lives and how you run it, and what a wonderful example you are to your children and to females in medicine and all students of medicine, just to see the balance, the work-life balance. It's not easy, but you guys really do a great job at it. So congratulations to you, and thank you for being here. I so appreciate it.
Thanks, Lauren. Thanks for having us.
Thanks for having us. It's always fun being with Danielle.
Yeah.
Hey, and I'll be sure to post and give more information about the Inspire. Tell us the official name of the event.
It's Inspire Women of Orthopedics Summit.
Okay. We invite everyone to join Dr. Bishop and Dr. Ponzio at this year's Inspire Women in Orthopedics Summit. It'll be held on Friday, October 10th at the beautiful Four Seasons Hotel in Philadelphia. Registration is open. Go to rothmanortho.com to register, and you can find more details there as well. We hope to see you there. Thank you both. Get back to your children. Dr. Bishop and Dr. Ponzio, thank you both so much for your time and for sharing your honest journeys. And to our listeners, especially any girls out there who dream of being a mother one day while holding a career, you can do it. These ladies are proof that it can be done. And for the mothers and caregivers who are making it happen each and every day, you got this. It ain't easy, but I'm rooting for you, and I'm sending love and energy your way. So thank you again for listening. Stay healthy, stay strong, and take charge of your health. I'm Lauren, and you've been listening to The Breakdown.